Hi, you guys. Welcome back for our daily practice questions. It is day 144 and day 14 of our Pharm series. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you do not miss any of my videos. And if you would like access to my MP Test Success Toolkit, it's free and is linked in the description. Question number one states, a 52-year-old man with newly diagnosed hypertension and no other medical conditions asked about treatment options. According to the ACC and AHA guidelines, which of the following is a first-line therapy for this patient? Is it A, a beta blocker, B, an ACE inhibitor, C, a thiazide diuretic, or D, ARBs? Take a moment and tell me what you got in the comments, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, according to the ACC and AHA guidelines, which of the following is a first-line therapy for this patient? All right, so let's see what we're even talking about, right? So we have a 52-year-old man who is newly diagnosed with hypertension and does not have any other medical conditions. So what is a first-line therapy option for this patient? And your best answer is C, a thiazide diuretic, because they don't have any medical conditions, right? So that's your first line option. Question number two, and hold on, I'm going to go back to question one just to explain those answer choices. So if you're wondering why, remember I tell you the four first line therapy options for hypertension management are thiazides, ACEs, ARBs, and calcium channel blockers, right? So you already can eliminate a beta blocker because that's not even a first line therapy option for blood pressure management. Now, the reason ACEs and ARBs were not a selection because we use ACEs and ARBs as first line options when there are comorbidities that require renal protection. This patient does not have any other medical conditions. And remember, thiazides are the captain of the first line therapy options. So if there's no reason that we need to rule out thiazides for being utilized, then you use those first, okay? All right, question number two. A 60-year-old Black female is diagnosed with stage 1 hypertension. She has no history of diabetes or chronic kidney disease. Which of the following is the most appropriate first-line treatment? Is it A, lisinopril, B, chlorothalidone, C, losartan, or D, spironolactone? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question here. Which of the following is the most appropriate first-line treatment option? And y'all know what I say. If the stem of the question is looking for treatment, you need to run it back and see if a diagnosis has been provided. Here it has. This is a Black female diagnosed with stage 1 hypertension, and she has no comorbidities. So, what is a first line therapy option for this, right? So, we know we just discussed our four first line therapy options for hypertension, but also now you need to narrow it a little bit more. Remember, for the Black population, thiazides and calcium channel blockers are first-line therapy options, right? With, again, thiazides being the captain. So a thiazide is still going to be that first option you want to go with. It also states that the patient does not have diabetes or chronic kidney disease, so they don't need an ACE or ARB, so we're going thiazide. So B is your best answer, as chlorothalidone is your thiazide. Make sure you know your medications. Learn your endings so you know drug classes by the ending, so it makes it easier, right? So A is an ACE inhibitor, right? ACE inhibitors end in pril. Chlorothalidone is a thiazide. Losartan, sartans are ARBs, right? And those are the only first-line therapy options. And just for medication sake, before we move to the next one, spironolactone, is a potassium-sparing diuretic. That's not even an option for your first-line therapy options for hypertension. All right, lastly, question number 3. A 66-year-old male with hypertension and chronic kidney disease requires treatment. Which of the following medications is the most appropriate first-line agent? Is it A, amlodipine? Is it B, hydrochlorothiazide? Is it C, lisinopril? Or is it D, metoprolol? Take a moment and tell me what you got, y'all. All right, so stem of the question states, which of the following medications is the most appropriate first-line agent? All right, so again, what are we treating? This patient has hypertension, right? And he also has chronic kidney disease. So you have to think about, how do you treat patients who have chronic kidney disease or any other comorbidities that require renal protection when managing their hypertension, right? So remember, we use ACEs or ARBs in these scenarios. So we want to look to see for our ACE or ARB. Remembering on boards, they're not going to give you both unless there's something that specifically says why you can't have the other, and there's a reason that you can rule it out, right? So here, amlodipine is what? A calcium channel blocker, right? So that's not the option we're looking for. Hydrochlorothiazide, aka HCTZ, is a thiazide diuretic. We're not looking for that. C is lisinopril, which is an ACE inhibitor. Okay. And then D, metoprolol, is a beta blocker. LOL, beta blocker. So remember, C, enzapril, is an ACE inhibitor. We're looking for an ACE or ARB because this patient has CKD, so they need renal protection. Even though we're treating hypertension, we want to make sure their kidney function is maintained and protected. So C is your best answer, okay? And as you navigate through your hypertension management questions, this is how I want you to walk through it, because they are testing on the ACC and AHA guidelines, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio1@gmail.com. Everything that we do offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, custom packages or plans, or question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.